welcome in. So you're here for a dental exam. We can get that started right away. Let me just put on some gloves and a face mask. So you've been having some pain in your teeth. Interesting. So how long has this been happening? Okay. Well, I just got my gloves on. It's pretty easy. Usually I don't do that great. But we are just going to be looking inside your mouth. So I'm just going to need you to, let me see, open your mouth wide for me. Just going to look inside, see what's going on. Okay. I do see your gums look pretty red, a bit swollen. Okay. Yeah. Okay. Same thing, but I'm going to use a different flashlight. I'll just look. Okay. Yeah. Do you floss normally? Okay. I'm just gonna put on my face mask. Actually, it's this way. Okay. So, we can begin. I'm gonna need you to open your mouth, and I'm just gonna get a quick scan of your mouth. So just keep your mouth open. I'm gonna get a scan. Okay. Good. One more. Very good. Okay, we're gonna do something like that again. This time I'm gonna need to put some like plastic around it. One moment. Let me just get this prepared. Good. Wrap that up in the plastic. Same thing here. Just stay still. Alright, just gonna change the color quickly. Okay. Just doing little scans here. Very good. Let's take out that plastic. And I'm just going to lastly get your temperature. Okay. So I have this. We always gotta make sure that our patients are not sick. So we are just going to get your temperature with this temperature gun. So stay still. Okay, let's do it again on this side. Okay. Very, very good. You have a good temperature. Fantastic. Just gotta make sure that you aren't sick. So I'm gonna use this again. This is gonna be something where you just keep your mouth open so it kind of helps me there. So just stay still. I'm gonna put some of this solution in your mouth. So stay still. This is going to help with the pain. Good. You're doing great. So right now we're kind of waiting on those scans to see what is going on. So right now what we can do is I'm just going to touch around your face, around your jaw, see if the pain is also external. So just going to touch around. Let me know if you feel any pain. No pain, right? Good. Okay. So while you wait for the scans, I have a toothbrush here. We're just gonna brush your teeth quickly. Okay. So just put some toothpaste on there. Open wide for me. Good. Very good. Okay. And now I'm just going to use this floss here. Open wide again. So I'm looking here, and the scans are looking like, so you have a cavity, okay, and it looks like you have a lot of plaque as well. We can definitely get rid of that, and we could definitely fill that cavity, okay? All right, so I'm just going to use this here, and I'm just going to press along your teeth. Let me know if you feel any pain, okay? Do you feel pain there? Okay, how about there? There. Okay. Just wanted to see what your pain tolerance was looking like. Everything looks fine there, so we can get started. We don't need to numb anything. So I'm just going to get some tools there. So I have this tool, and I'm just going to use this to get rid of that plaque that's in between your teeth. Okay, let me know if you feel any pain. We are able to get rid of some of the plaque, and I'm just going to spray some water. Okay, so just open wide. So now we need to get that cavity filled. So here is basically your teeth. Okay, so it's looking like you have a cavity here and on the other side as well. This one isn't as bad. This one is very deep, and we're gonna fill both of them today. Okay, the rest of your teeth look very good. There was some plaque in between the teeth, but sometimes that happens when you don't floss enough. Even if you do floss a lot, sometimes stuff gets stuck and it's hard to get to. So totally okay. But yeah, we're gonna get rid of or fill these two cavities. So we're gonna do that right now. So I'm just going to put a sheet on you quickly. Alright, just stay still. Just don't want to dirty your shirt here while you're moving. There's gonna be water spray and all that. Okay, good. So I'm gonna take this tool and this tool. So I'm gonna be spraying water while filling the cavity. So we're gonna start off with this tooth here. Stay still, okay? Okay, just going to use this. gonna touch around. Very good. All right. Now I'm just going to use this again, this tool, and touch around. Keep your mouth open. Does that hurt? Very good. Let's take off that sheet. Alright, we are going to do a few more scans to see if we were able to fix the problem. So I'm going to do the scans from before. Here. So we're going to just do that. Keep your mouth open. Alright, ready? Good. Good. Other side. Perfect. Great. Okay, we don't have to do the other scan, just that one, but we're going to do a different one. This one measures the heat. Let me try to change the, there you go. Okay, so this measures the heat around your jaw. So just stay still for me. Very good. Okay, so your temperature is looking good there. All right. Can you open your mouth for me? Just want to look inside while we wait for that scan. Keep your mouth open. I'm going to be touching in your mouth. Okay. Good. Okay, so you just got your scan. So the plaque definitely has improved. I don't see as much plaque as you had before. And your, let's see, your cavities look good now, filled. Okay, so I'm just going to end the appointment here, and we're going to be sending you home with some pain medication to help with that area because it is going to hurt. And try not to eat anything that you need to chew. I would recommend like soup, something like that, something easy to eat to not irritate your back teeth. But yeah, I think that is the end of the appointment today. Everything's looking really good. We were able to do everything perfectly. But yeah, thank you so much for coming in. Thank you for letting me examine your teeth. and I hope you have a lovely rest of your evening, okay?